Thanks very much. Why should integrated health services include lawyers? I hope by the end of this short presentation that you'll have some understanding of why I think they should include lawyers, and that you have exposure to some examples of how this happens in practice here in Australia. But also I want to leave you with some thoughts about how we might progress this idea, what else we could be doing in this arena. So I'm going to talk firstly about some research that supports this idea of having integrated health services with legal services. Then I'm going to give you those examples, and then I'll talk about the experience here at La Trobe. My background is in law, and I guess I've spent a career looking at issues of access to justice and thinking and working with people about how to improve access to justice. And this idea for me very much encapsulates what we need to do in order to do that today. I'd like you to imagine that you're a health worker in a community health centre, a primary care provider, and that you're seeing a lot of children with asthma, and in particular chronic asthma. And you have provided the range of treatments that are available to you, but the situation doesn't seem to be getting any better. And then one day a community health nurse comes to you and says that they have been to visit the family in their home. And they've realised that perhaps one of the contributing factors to this chronic asthma is in fact the mould that is in the house, the poor condition of the house, the lack of heating during winter. And you can see that this person, this family, this child's living conditions are contributing to their health situation. But you feel incredibly frustrated because there doesn't seem to be anything that you can do as a health worker to assist that family. I want you to think of another scenario. Again, you're a health worker in a large public hospital, a large women's public hospital, and you're daily dealing with women coming in about having their babies or the follow-up to having children and a range of other issues. But you're particularly concerned with a number of women that come to you who you're concerned about their welfare at home because you notice a range of bruising, you notice a sort of anxiety, perhaps a withdrawn nature, and you have a suspicion that there's violence happening at home. And again, you can see that that's impacting on this woman's health. But you're again very frustrated. You don't know what to do, where to suggest that woman might go to get some assistance, but you know it's impacting on their health. So keep those scenarios in mind, and I'll now move on to why I think having a lawyer involved in those health provision facilities is important. There's a large body of international research that has looked at what sort of problems people have that might have a legal solution. So, more colloquially called legal needs survey, trying to assess what's the extent of legal needs in the community. There's been over 26 of these studies across the world, but most recently and relevantly for us here in Australia, there's been the release of a very large survey in October of last year. And that was done by the Law and Justice Foundation in New South Wales. They interviewed over 20,000 people across Australia about what legal problems they may have had in the last 12 months, what they did about those legal problems, and what was the impact of those legal problems on them. This Australian study, together with the other international studies, confirms strongly that what I think many people in the health and legal sector already know, that legal problems come in clusters, that there's often a trigger event that causes the sort of the development of a range of legal problems, and that legal problems have a connection with health problems. And I guess again, if you thought about a common situation, if somebody has an accident or becomes ill and as a consequence loses their job, they'll have a reduction in income. That may then lead to the fact that they fall behind in their various credit payments or their loans. They then also may fall behind in their rent and they'll get into housing crisis. It will quite likely exacerbate the sort of family situation. And so a whole range of things can trigger from one event. This survey also shows that legal problems, though, are not concentrated evenly across the population. There are certain groups in our society who suffer more legal problems than others. And it's not, again, I don't think it's unexpected, but this data shows very clearly there is a link between legal problems and social exclusion or disadvantage. And so those, in particular, the Australian research has shown that the people who suffer most from legal problems are people with a disability or a long-term illness, sole parents, the unemployed, people living in disadvantaged housing and Indigenous people. For this discussion, one of the most telling statistics is that, as I said, people with mental illness and a physical or illness or a disability have 10 times more likely the chance of having legal problems than people without those conditions. Equally, we know from these surveys about the impact that legal problems can have on people. And so we know that of that 20,000 people that was surveyed in Australia, 20% of them said that their legal problems led to stress-related illness, 19% said it led to physical ill health, and 10% said it led to relationship breakdown. So there are significant, impacts that come from having legal problems. Related, we asked, the survey asked, where do people go to get assistance with these legal problems? Well, only half of the people who said they had legal problems actually did anything about it, though they did seek some advice. But interestingly, where did they seek that advice? Well, only 16% of them actually used a legal practitioner or a lawyer. 27% of them went to health and welfare workers, and 18% went to actually doctors and GPs. And so that's the connection here with this idea of having lawyers in health facilities. That people already go to those health facilities to get advice. They go to health and welfare workers, but they don't necessarily have the means or the ability to assist them in their legal problems. As I've already indicated, there's a lot of evidence to support the fact that there's a causal connection. That if you have a legal problem, you are likely to, that will impact on your health and you may well get sick. Equally, if you have an illness or a disability or some sickness, that is, you are likely to have legal problems. And so there's a connection here between these two areas. So let me now talk about where that leads us. Again, each of these various studies around the world have suggested that the way to address this connection is that we need to provide legal services within a holistic or a multidisciplinary fashion. And that means an integrated health service scenario. If we do that, we can think about both obviously addressing the individual needs of the client/patients, but it also has a preventative aspect to it. If we can get those legal problems at an early stage, it may well stop the trigger effect from happening, and that hopefully will have a positive impact on people's health and well-being. How might this be done? How do we think about bringing lawyers and health professionals together? In the United States, there is a growing network of organisations which describe themselves as medico-legal partnerships. And this is the idea of having lawyers in a medical facility, and it began in Boston with a paediatrician in a public hospital, a bit like that scenario I talked about, worried about the chronic asthma for the children, and they brought in some lawyers to actually be physically located in that public hospital. So the idea of these things is that they can provide on-site services to the clients, and there can also be training and education of the various healthcare and legal practitioners. As well, though, there is the the focus is not just on the individual, but is on about systemic advocacy as well. So that trying to work more broadly to address what will be a whole range of social determinants of people's health and well-being. Australian examples. This is not a new idea. There have been people around, and both in the health and welfare sector and legal sectors, who talk about holistic provision of services, multidisciplinary services, etc. And so there are several examples in Australia. One that again relates to one of the first examples I gave is a program that's currently operating at our large Royal Women's Hospital here in Victoria, and there's a local community health legal centre that is working with the doctors and the allied health staff at the public hospital around this issue of family violence, and assisting the health workers to identify aspects of family violence and informing them and educating them about what they can then do to assist the women and to provide, and the legal service then provides a referral spot for the patients that the healthcare workers are working with. Here at La Trobe, we've been involved in a project that takes an integrated approach to these issues for well over 3 decades. There's a local community called the West Heidelberg community that's a very disadvantaged community in Australia. And as I said, about 3 decades ago, the university recognised that they wanted to be involved in that area in some way. And so the law school at La Trobe dedicated a academic to establish the West Heidelberg Community Legal Centre within the Banyule Community Health Centre. And the Banyule Community Health Centre is a large primary care facility, has over 150 staff of all sorts of allied health and doctors and dentists, etc. The legal service, a much smaller organisation, but co-located in this very large health facility. And the great thing about this program is that we have had students down there all during that decades. That we have students working in the legal service under supervision of a lawyer and an academic, providing legal services, but in this integrated environment. Not only, again, do I say they do individual services, but they have worked on a range of law reform or policy type issues. And one of them that they identified was the issue of housing. And that brings us to that example that I talked about again earlier. The students identified that housing was an issue for the clients, and they are working now with a range of the healthcare providers around that issue. And this is just a sign of the reception area, which gives you an indication of the range of services that are provided at Banyule Community Health, and you'll see there that legal service is just one of those that are there. So that's been a long-standing partnership that we've had down at the local West Heidelberg community. This picture of some of the students and our academic Peggy Curdo. So this idea is gathering momentum in Australia, and there are numbers of people who are working on how to advance the idea, and they've come together under the title of Advocacy Health Alliances. It's also beginning to be discussed and recognised in the health sector as well, and so recently at the Public Health Association of Australia conference there was a declaration which reaffirmed the support for this multidisciplinary approach to include both legal and health issues. So what though can we do here at La Trobe to advance this idea and to promote the idea of why integrated health services should include lawyers? What I suggest is that we have the opportunity. La Trobe has always been a leader both in legal education and in the health services area, health sciences area. We have the opportunity, I think, to be a leader in the provision of education about integrated services, and we can do that as well through our external engagement, because we have a range of clinical opportunities. The law school has one down at West Heidelberg. Health sciences have any number of clinical environments where students participate in activities. My idea is that we should work towards getting those students to work together, that we have health science students and law students all working in the one environment and addressing clients' needs, patients' needs in a holistic and a multidisciplinary way.